Thank you, everybody, for joining us tonight for the virtual information session for the bachelor's program in speech pathology and audiology. I know it's a beautiful day outside, at least in Danville, Pennsylvania. It is. I'm sure it is where you're at as well. So we appreciate you taking time out of your schedule to learn more about this program. I'm joined by Dr. Tom Zaleski, the department chair for the Department of Communication Sciences and Disorders, which is an umbrella that would include speech pathology in audiology at the undergrad level, the master's program in speech language pathology, the doctorate of audiology, as well as the certificate in IONM, which we'll talk more about some of those programs here during the event. But before I go any further, Dr. Zaleski, could you introduce yourself and give us a little bit of a background before we get started?
Sure. I'm Dr. Zaleski. As Tom had indicated, I'm the current interim chair of the department. I'm a professor of audiology. I'm also the Doctor of Audiology graduate coordinator. Prior to jumping to academia, I worked clinically for 12 to 14 years. I worked in private practice, worked in ENT offices, worked in some hospitals, and jumped to academia. I've been here. This is my 25th year. My area of expertise is central auditory processing and tinnitus.
And Dr. Zaleski, you are also a Bloomsburg grad. We were talking about that.
Yes, I am. Yeah, undergraduate, and got my master's in audiology way back when, before you needed the doctorate, and then went back after a year out, started off at Columbia, and then finished up at NYU with my PhD.
Yep, and some of you probably recognize Dr. Zaleski from the bit that he did on the news. It is on the audiology website. I know Dr. Zaleski is a person who is well known in the field. And I'm going to probably get the name incorrect, but what were you interviewed for then, Dr. Zaleski? It was on WNEP, I believe.
Oh, you're talking about the WVIA, the Call the Doctor?
WVIA, yes.
The WVIA,
yes.
the Call the Doctor. We did a segment on tinnitus.
Yes, yep. And Dr. Zaleski has done a lot of virtual events with us, so you've probably seen him at some point. He's the front man for the CSD department, so and certainly in very capable hands here. Dr. Zaleski, do you want to bring up your presentation? The
Sure.
event should take probably around 30, 35, 40 minutes, and then after that we can open it up to Q&A. If you have questions in the meantime, please don't hesitate to ask those. If you just put them in either the chat or the Q&A, I'll be monitoring both of those, and I can get those questions to Dr. Zaleski. And also, too, as we're waiting for the presentation to start, one thing I do want to plug as well is the website for the speech pathology and audiology program. There's a lot of good information there that will help take you beyond kind of some of the cursory information that you might know about the program or the field. So that's a good way to kind of go behind the scenes among some of our visitation options. But I see Dr. Zaleski has his presentation up, so Dr. Zaleski, I will turn it over to you.
So welcome, everybody. As we said, we're here for the undergraduate program in communication sciences and disorder. So you know that, so let's get started. We have, again, I won't read it, but we have been around for a long time. Our program has been offered since the 60s, and through the years we've evolved from just a bachelor's to a master's, and now with the audiology, with the doctoral, we've expanded what we've offered, as well as then expanding into intraoperative neurophysiological monitoring, which I'll talk about in just a little bit. So we are not a new program. We're tried and true. We've been, we've worked through the kinks, and we think we have it down where it's a pretty good process at this point. So and so we'll go on. So you guys know, if anybody has any question, please put a question or into Tom, and he can relay it to me. Okay. All right. So what is the purpose of our undergraduate program? Our undergraduate program is a little bit different than some other programs. To become an audiologist and or speech language pathologist, you have to go to graduate school. So the purpose of our undergraduate program is to prepare you for graduate education. Yes, can you get a job with just your undergraduate degree? Yes, you could be a speech and hearing assistant and work underneath the auspice of an audiologist and or licensed audiologist and or speech language pathologist, but you won't do anything independently, and there's not a ton of jobs available at that point. So really our focus is to prepare you for graduate school, whether it is here at Bloomsburg or some other program. We have placed students all over the country. So that's one thing you don't have to worry about. All right. So big question everyone always asks, will I get a job? Short answer, yes. There is a huge need for audiologists and speech pathologists, in throughout the country, for a number of reasons. One, the newborn infant hearing screenings and as well as the early intervention programs, providing services to, we all know that the early intervention is the key. The earlier you identify, the better off everyone's going to be, and in the long run, you'll minimize issues. Also, as the population gets older, people are having issues, just like everything else. Joints and eyes and everything wear out, ears wear out also. And then as people get older, they have other medical issues, may have a stroke or some other issues, cognitive decline, and speech language pathologists can work in those capacities. So we are truly both audiology and speech language pathology that are basically birth to grave. We cover the whole spectrum, and they're needed all over the place. Yes, there is a severe shortage of speech language pathologists and audiologists. Probably about a year ago, maybe even less than that, I think, I was on a listserv that I belonged to, and it wasn't the United States, but it was in Britain. And they said they did a survey, and what they found was there is a severe shortage, and if all the audiologists would retire who are eligible to retire currently, there wouldn't be enough audiologists to serve the people who need the assistance. And that's very similar in the United States. Also, as the second bullet point says, bilingual clinicians, due to the greater diversity of our population, there was a great need for bilingual speech pathologists and audiologists to serve their needs. So there is a huge needs for the whole bit, right? One of the unusual things or nice things about our undergraduate program, we do offer a conditional acceptance program. And what that is, we offer up to 23 seniors guaranteed admission into our graduate programs, 15 speech, 8 audiology. It's a competitive program. So it's based on your cumulative GPA at the beginning of your fall of your senior year. Our current criteria is you got to have a minimum of 3.5. And then what happens is you get ranked. There always is more students interested in speech than audiology. So what happens is if we have 50 students in our undergraduate program, there might be a handful of individual interests in audiology. That means about 45 students are interested in speech. We can't take all of them. So we'll rank. And if there are 20 students that meet the 3.5, the first 15 will get the offer. Same thing with audiology. Usually we don't meet the 8 because usually there's not that many students interested. The requirements can vary from year to year depending on what's going on in the program, but it's a nice way if you're a strong student without worrying it. And really, if you think about it, if you are interested in the field and you're interested in coming to Bloomsburg, really, you only have to do one application because applications are expensive, anywhere from 75 to 150 bucks. Average student applies somewhere between 5 to 8 applications. So even at 100 bucks, take it easy, and they apply 5 to 5 different places. That's 500 bucks. Applications fee. If you're a good student and you want to come to Bloomsburg, you have one application, 100 bucks. And a lot of times, what will happen is, and Tom can talk more about that, you come to events, and a lot of times they'll waive the application fee. But our application is through SIDCAS, and you got to pay through that. So that's a whole other aspect. So it's a nice little way to save money also.
And Tom or Dr. Zaleski, if I may, so this is really important too, because as you are someone considering going into this field, you already know you need an advanced degree. That's the bare minimum. It's like basically if you want to be a doctor or a PA, you have to have a medical degree or a PA degree. This is no different. So you already have to be looking down the road, right? You're playing chess, right? Not checkers here. And knowing that we have the master's degree or the doctorate degree, and we also have the certificate in IONM, that should be an important part of your decision-making process. Now, obviously, there are some expectations in order to qualify to be one of those 15 or one of those 8. But if we didn't have that, and there's a lot of undergraduate degree programs out there where they do not have the master's or the doctorate program like CU-Bloomsburg does, you're hitting the reset button. You're having to start to apply to all these other locations, having not known the faculty, having not been familiar with the facilities in the campus itself. So that's a big plus if you are considering the undergraduate degree program here at Bloomsburg in speech language pathology and audiology.
And that's a good point, Tom. What you have to keep in mind is I can't tell you the number of students who come in speech, and they get a couple of audiology courses, and they're like, hey, I was talking to a student. I taught the Introduction to Audiology course. Was it last fall or last spring? A student came to visit me and said, you know what? Prior to this course, I never heard of audiology. Never knew what it was, never heard of it. Hey, this is pretty cool. I think I want to do audiology rather than speech. And so if you go to a program that may have an undergraduate program, but not the speech program, then you won't have the same opportunity to stay and go in through the audiology program. The other thing, I'm going to go into advisor mode here just for a little bit. The key is if you want to do it, the first few semesters, well, all semesters are critical, but the first 2 to 3 semesters are critical, because if you come in with no credits or a few AP courses, and so what you got to remember is so say you have a B, you have 2 C's, and you have 2 A's. So hey, I did pretty good. Guess what? That's a 3.0. Right there is a 3.0. And so what happens is sometimes students dig themselves a hole because they have a difficult time in transitioning, getting used to college on their own, and they struggle. And so they end up having GPAs sometimes of 2.5s, 2.6, 2.3s. And what you got to remember, as you get more credits, those quality points get distributed over more and more credits. And so it's harder to make changes in your GPA because it's being distributed over so many credits. So that's why I always tell the students, undergraduate students, I advise them, your first 2-3 semesters, you want to knock it out of the park. And in that way, if you don't do well and you get further along, it doesn't hit your GPA as hard. All right. Anybody have any questions?
I don't see anything yet.
Okay, Great. So that's our conditional acceptance program. So just a couple of highlights, about our program. If you come to our program is set to meet the minimum requirements for you to continue your training in graduate school, speech or audiology. So it doesn't matter. We're not just setting you up to come to Bloomsburg. You can go any place. You can go to Pitt. You can go to Tennessee. You can go to Syracuse, University of Maryland, so you'll be fine. Okay. By graduating in this degree, you'll be prepared to go, because keep in mind, the undergraduate degree, as Tom said previously, is the umbrella. And so there's no difference if you're interested in speech or audiology or the intraoperative neurophysiological monitoring program. All exactly the same. So you'll get the same exposure, you get all the courses, and then you can choose based on your interest whether you want to do speech language pathology, audiology, or decide to do intraoperative neurophysiological monitoring.
And Dr. Zaleski, can because this is one of the things I remember learning a little bit ago is people, really you go in studying both subjects, and then at some point in your academic career, you have to choose, well, do I want to go speech language pathology or do I want to go audiology and maybe IONM? At what point in their career are they doing something like that?
That's not until their senior year.
Okay.
When they're applying to graduate schools. We do have some students that aren't sure, they're interested in both, and so they'll apply to both. Even here, some of our undergraduate students, we talk between each other of the faculty, and hey, XYZ, I thought she was interested in speech, and she also applied to speech. And it ends up the student's not sure what they want to do. So people do sometimes apply to both programs, but it's not until you're applying to graduate schools that you have to make your decision, or you don't even have to make that decision. You can apply to both programs and then see what happens from there. Okay.
Thank you.
We also have a on-campus clinic for training our graduate students in both speech as well as audiology. Unfortunately, our undergraduate students are not exposed to that. That's simply because we're a full functioning clinic and we have to be aware, but we do have one for our graduate students. And as it says below, we do offer, not just the speech language pathology, that is much. There are many more programs with speech language pathology. There are only like 70 programs in the country that offer audiology, and even fewer that offer intraoperative neurophysiological monitoring. So we offer all three programs. If you're interested, the type of courses you can see, typically we start off with the introductory courses. Introductory communication disorders is just a general overview of both professions, and then an overview of audiology, and then you start getting the foundation for some speech aspects, and then you go further along with other that builds upon those, and a couple more audiology courses. The auditory training and speech reading is an audiology course. Fundamentals is audiology. But those are all courses which benefit you. A lot of students will say, why do I want to take these speech courses if I'm interested in audiology? Because having worked clinically and tested people, a lot of times people will come in, especially with children. I went to my pediatrician, my child's not speaking correctly. I don't know why they referred me to audiology. And then you have to explain, well, you say what you hear. And sometimes people who have, or children who have speech and language and articulation problems is not just due to a speech or language or articulation problem, it's due to a hearing problem. If you're not hearing it right, you're not going to say it right. And so having that fundamental background allows you to address those questions appropriately. Okay, so again, it's a building process. So we start off general and get more advanced as we go along. And again, still, even some of the courses like assessment remediation of speech and applied speech science and psycholinguistics, they're still just a sprinkling of what you're going to get in graduate school. It's giving you the introductory information, firm foundation. Some students talk about having minors, and these are some really good minors if you're interested in the field. ASL, if you're interested in audiology, having a background. People sometimes will come to me and say they want to take a minor in ASL, and I say why. They're interested in audiology, and I always try to make sure people understand most of the time, you are not going to be using sign, because the purpose of audiology, for the most part, is getting people to use their hearing. So a lot of times you're not using your sign unless you're in the pockets where they are, like at Rochester, New York, by RIT, or down around Gallaudet, or large metropolitan area. There is a need for them, but our governing body does say students going to audiology have to have some knowledge of ASL. And speech, there's a need for speech pathologists for ASL. So if you want to work with kids who have severe and profound hearing loss, there is a need for speech language pathologists who know how to sign, to work with them. So there are those pockets, and there are those aspects. Psychology is a great minor for both speech and audiology. It teaches you how to critically think and put things together. Years ago, I remember I took a child psych course when I was my undergraduate, and when I work with kids, I still use some of the things that I learned in that class. So it's very beneficial. Spanish, it's a very common language in the States, and if you want, you can show that you are a bilingual speech pathologist and or audiologist, you will be white hot. There's a huge need. The only problem is you have to go to where those pockets are. You want to be an audiologist or speech pathologist in Bloomsburg, being bilingual in Spanish is probably not going to help you. Going up to Hazleton, going to be a big help for you, and so that's the important parts. If you're interested in working with children, or working in a school setting, having that special education background or child life specialist, those are all good combinations which will benefit you in your profession as you later go on. Any questions?
Well, and Dr. Zaleski too, I think this is one of the things that makes the Bloomsburg, speech language pathology and audiology program so powerful, is because of this ecosystem that resides of not only having that degree, but having ASL, having special ed, having the child life specialist, where you can complement your bachelor's degree with some of these other even more unique programs. And it makes you that much better of a practitioner or an applicant to graduate school, or a better, clinician as you enter the job field.
That's exactly right. Those are all great, and that's one of the unique things, because the ASL program, we are one of the few programs or facilities that offers an ASL program. So there's not many places that offer that. Any questions? We good? Okay. All right. So again, as Tom had indicated, that you're going into this thinking, all right, I know I got to go to graduate school, but you may not know what these professions really are. You may know one, you may not know the other, for whatever reason it is. So we're going to give you a little background on that. So let's first talk about audiology. Where do audiologists work? They work at a lot of different facilities. You can have your own private practice. You can work in medical settings, hospitals, physician offices, clinics, VA hospitals. You can work in equipment manufacturers, being audiology equipment, hearing aids. You can work in government. You can work in personal care facilities. You can, like I do, work in a university setting, teaching and research and all other things. You can work in a research lab and get into forensic. Here is a picture of our students with one of our clinical supervisors. getting someone ready for our rotary chair. We are one of the few programs, audiology program, that actually has a rotary chair. All right, so those are where you're going to find audiologists. What do we do? Well, most people think about all we do is sit in, the old test at school. Beep, beep, beep. We do much more than that. And it's not just a matter of how's your hearing? It's a matter of how is your auditory system functioning? How is it working to allow us to identify where the problem lies so we can make the appropriate recommendations, whether it is for further testing, for rehabilitation, or fitting devices, right? We do balance if people are dizzy or off balance, and that's what the rotary chair does. It's specialized testing for balance issues to find out, is it something going on in the ear, is it in the brainstem, or is it cortical that needs to be taken care of. Tinnitus, ringing and buzzing in the ears. We can evaluate people, and we can do things to help people cope with it better. Very similar to chronic pain, can't make it go away, but we can teach people how to deal with it better. Auditory processing and auditory processing disorders. It's not per se a hearing loss, because most people with it have normal hearing. Easy way to put it is, as Dr. Jack Katz says, it's what you do with what you hear. It's how the brain uses it. I like to say it's like being colorblind. Do you have a vision problem? No, you can see the letters, but ask you to pick a red and a green ball. That's kind of what happens here. How your auditory system is using the information, and as well as intraoperative neurophysiological monitor, because that falls under our scope of practice, and that's why audiologists are a good fit with that. And we'll talk more about that in just a little bit when we get to that. All right, so job market, as I said previously, yes, there is a huge need for us. You can see Money Magazine and U.S. News list us as the 22nd best healthcare job, and overall the 79th out of 100 best jobs. Faster growth for the next 10 years. So again, you're going to, because as the population is getting older, early intervention, it's a huge need. And then again, careercast.com, we're the 14th best job out of 200. So it is a good profession. So it's not like, oh, am I going to have a job when I get done? Yes, you will have a job. Most of our students have a job before they graduate, if they don't stay at the facility where they do their 4th year experience. Any questions on audiology at all?
Well, and I think one of the more interesting things too that, and I think you kind of indicated this on the previous slide, Dr. Zaleski, was all the things that audiology, it's not just about hearing. Like oftentimes it is a window into how, your body is functioning. And that is kind of like among the checkpoints,
Correct.
So I think that's really, so like you'll see people who are coming in for reasons other than, maybe they're hearing, they're having issues with tinnitus. It's because that's, again, among the early checkpoints or biomarkers for people who are suffering with some health issues.
Correct. And that's why I often tell students when I teach the course that, people can have ringing and buzzing ears for a lot of reasons. Could be very benign. Oh, I have some wax in my ears. I have fluid in my middle ear. Oh, I have some hearing loss. To, oh, I have a brain tumor. I have an infection along my 8th nerve. Oh, I'm having heart problems. Oh, I have a blood vessel that is bent too much and it's occluded, and you're getting the whistle through it. So it all sounds the same way. We have to have the knowledge to figure it out, where the problem is. Is this something more serious, or is this something that we can deal with? So that's why you got to have all that background. All right, we good? No questions on audiology? Okay, so then let's move into intraoperative neurophysiological monitoring. As I said, audiology is a great tie because we do some of the things that they do, it just takes a little bit further. Basically, what intraoperative neurophysiological monitoring is, you're part of the surgical team. You're in the OR with the surgeon and you're doing real-time monitoring. And it's there to prevent further injuries. So, if someone's having brain surgery and the physician has the craniotomy, retracts part of your brain to get into something. And so now we're doing cortical responses and we see a change in the response. And that's where you got to talk and say, whoops, time out. I don't know what you did, but whatever you did, something has changed. And so now the surgeon has to make a decision. All right, can I retract this and approach it from another side, or this is the only way I can get at it? And so now the thing is, hopefully now when we do those, we can then prevent injury. So again, and your brain controls everything. So perhaps it's in the speech and language area, and when they retract it, well, now if we see those things and they let it go back, now you still might have your speech, versus if you let it go, you may not have speech. Or spine surgery, fusing spine, they tighten the screws too much. Oh, I can't move my feet. I can't feel my feet. But we can do, the intraoperative neurophysiological technicians can do the measurements to say, hey, something's different, and they can loosen things up and they're not going to have any problems. Right. So where are you going to find IONM technicians? Basically hospitals, surgical centers. There are some private practice or some private companies that they contract out for services, but primary hospital surgery centers where it can be employed by a private company. Here is our lab there. You can see we have a mannequin and students learn. That's Dr. Yu, who's the program coordinating, teacher people how to apply the electrodes. And so that's what it's about. We have the mannequin so people learn how to place the electrodes, how to measure them, and what's going on. As I said previously, what do we do? You're doing actual real-time monitoring during surgery to prevent injuries. So you want to make sure there's no damage to the neurological system, whatever you're looking at. We get called in for ENT surgeries. So if someone's having facial surgery, even a cochlear implant, as I said, spine, orthopedic surgery, brain surgery, the neurosurgery, just functional neurosurgery, cardiovascular. So there's a lot of things, and it's simply because of the litigious society that we live in. Everyone is concerned, oh, geez, if I do something wrong, there's going to be a problem. And so now this is one way of preventing it. I see we have some questions.
Yes, couple good questions from Ali here. Yes, so Ali provided a compliment here that she's happy that you're giving real life examples of where we can go with this degree, right? And so one of the benefits of I would say the size of CU-Bloomsburg is that you'll get advising like this. Because otherwise, if you're not getting advising like this, then it's on you to figure it out. And oftentimes what that means is it's like, all right, let me fire up Google and see what can I do with this degree. Well, this is your career, right? So this is pretty important. And it's not the kind of thing you want to farm out to Google. Not that there's anything wrong with that, but there's a better way to do it. And that's where tapping into someone like Dr. Zaleski or some of the faculty members that he's mentioned can really come in handy, because some of these other things you might not even have heard of until someone like Dr. Zaleski would tell you about it. So, again, just kind of an example of the value of the class sizes and things like that. Dr. Zaleski, so then will you be covering any required exams by the state when the education is complete? Is that something you're going to preview here, or is that even?
No, usually we don't, because again, this is focusing on undergraduates. There are no national exams needed for undergraduates, unless there are some programs that require the GREs, graduate record exam, for graduate school. But for audiology, speech pathology, or IOM, it's not until you finish the program. So it's not a concern for the undergraduate at this time. It's not until you get through graduate school.
And those are great questions. Yeah, keep them coming. Thank you.
Yep, real good questions. Again, don't be afraid to ask. All right. Any other questions about IONM? Okay, probably what most of you are interested in is speech language pathology. Okay, speech language pathologists are people do more than just working with people who have articulation, speech issues, or language issues. They can work with people who've had traumatic brain injuries, teaching them how to talk, teaching them how to swallow. People have swallowing issues, voice issues, people who have accent reduction, people who, if any of you are people who are cheer, a lot of times or you coach, they have voice issues through the vocal strain, and speech language pathology does all of these things. Okay, very much like audiology, where you find speech language pathologists. You can be in a private practice. You can work in schools. You can work. There's a huge need, as we talked about previously, for early interventionists. Speech pathologists working with infants and toddlers, giving them the advantage, but also as well as in regular K through 12 schools. There's residential health care facilities, so personal care facilities when people, again, may have a stroke, may not be able to swallow, may have speech or language issues from the cerebral vascular accident, being able to help them to learn how to communicate. They can work in the hospitals doing swallowing studies and voice, as well as their regular voice and speech and language therapy. You can work for industries and manufacturers for their equipment, kind of like they're showing here, a nasometer here, so people can look at their voice and their nasal capacity, how much, because some people sometimes talk like this. Well, the reason is they might be talking that they don't, for some reason, the soft palate in the back of your throat. Again, here I talk about having that good, strong foundation. I have not had a speech language pathology course many, many moons, probably twice as long as you guys are alive. But I still remember this stuff. So they may have some muscular control where the soft palate isn't closing right for some reason. And so we can do measurements to say, okay, yeah, they're too nasal, they're too breathy, and they can do training and therapy to improve that. So rather than talking like this, now they can learn to close that soft palate up so they sound much, much better. Okay. Again, at university, as we said previously, research, as well as local, state, and federal agencies. So there's a lot of area there. I will tell you, there is a huge need for speech language pathologists in the schools. Huge need, as well as personal care facilities. Those are really the two biggest employers of speech language pathologists, schools and personal care facilities. I believe the largest is school. I think it's like 51% speech language pathologists work in schools. Again, what do we do? It's not just working on speech related disorders and language disorders. They're swallowing. Somebody had an accident or a stroke or whatever reason they were in an accident, and they can get aspiration pneumonia, getting food and drink down their lung. That's not good. And so they can work with people and teach them on how to prevent that from happening. Here's a cool thing. What they just popped in mind when talking about voice is people who ever had a laryngectomy. laryngectomy, your larynx. That's what they call your voice box. And so there's little muscles in there that constrict and open up and vibrate, produces the sound. And so now, for some reason, if somebody has a laryngectomy because they've had cancer, well, what can happen is speech language pathologists work these people on how to talk, whether it is using a vibratory device, and I forget the exact name of it, where they kind of like belch and they control belch and they can resonate up to talk, and sometimes covering up the stoma where they still force the air up into them so they can talk. So they do things like that also. So it's not just speech and language. Fluency, people who have hesitations, like Professor Quirrell on Harry Potter, that would be his is a stutter and or a fluency issue. And speech language pathologists do things to train the people how to overcome it, how to control it, and those types of things. Voice, working with singers, to make sure the voice is produced the right way. They're not straining their voice, or, oh, geez, I've now had, 15 nights of concerts in a row, and now my voice doesn't seem right. Speech language pathologist teaches them how to use their voice properly so they don't damage their vocal folds and prevent or end their career because of those things. For example, you guys probably don't know, but Harry Belafonte years ago had a stroke, and he used to have a marvelous voice. He went to a speech pathologist to learn how to retalk and use his vocal folds because he had paralysis on one side. So there you go. John Glenn's wife was a stutterer. Speech pathologists address their stuttering. So there's a lot of good things out there. Again, speech pathology is another great job. Money Magazine ranks at number 35. US News number 10. Expected growth is almost 30%, far above the average. So are you going to have a job? Yeah. It's not like in some majors, oh, geez, how am I going to find a job? You're worried about it. Most people have jobs before they finish our graduate program. Any questions on it? Okay.
Yeah, well, actually, Dr. Zaleski, I do have a question here. So as you're looking at, because again, this is a decision that people are going to have to make, and again, it's not until their senior year, right, that they have to decide, if not a little bit after that. What's the work setting difference like here? Because that might be one of the things that influences people's decision, is if they're looking at audiology or speech pathology, like they might be wondering, like, what are some of the work? I know you talked about the work settings, but like the average work responsibilities, how are those going to differ? Like, is audiology more clinical? And
it varies. It depends on where you work, but for the most part, usually what I like to tell people is speech pathologists are people who like to work at things over a long period of time and see small, steady gains. So again, I'm working with someone who has an articulation problem, so they're talking like less, right? So or someone who maybe had a stroke and they're having a swallowing issue. So now it takes a long time to teach that person how to position your tongue in a different way to overcome the lisp, or how to overcome the swallowing issue. So you work with them for months, years, and see small gains over a long period of time, right? Audiology, for the most part, is people come in and you identify the problem. Here's what you're going to do. Done. And depending on what it is, You may see them a few more times, but it's not that long term, once a week, twice a week, 3 times a week for 9 months, 6 months, a year to resolve. Did I answer your question?
It did, yes. No, that's super helpful. It seems that like the speech language pathology would be more appealing to, like, it's almost like it's a consultative process where, again, like you're trying to fix this over a long period of time, like you had mentioned. And again, audiology, again, and I don't know if I'm using the right terminology, seems more clinical. Like you would go, like, or you go to a doctor's appointment, they assess, and then they provide a diagnosis and a treatment plan.
Correct, and it's truly how we're categorized by the healthcare administration. Speech language pathologists are classified as therapists. So for example, audiologists can do auditory training, teach people with hearing loss how to use their best hearing. We can do therapy for auditory processing disorders. However, most people don't come to us for that because we don't get reimbursed. Speech pathologists tend to do it because they'll get reimbursed by their insurances. So if people want to go to an audiologist, I know a lot of audiologists that do it, it's out of pocket. So an audiologist are classified as diagnosticians. So we come in, we identify the problem. That's why we don't get reimbursed for it. And actually, there's a bill being proposed to move us to providers, which would put us on par, the audiologists on par with nurse practitioners and physician assistants. So it'll open up more things that we can bill for and do things.
Gotcha. That's super helpful. Thank you.
Okay. All right. This is probably where you're going to take over, Tom, right? Or do you want me to do this?
Yeah, no, I'm happy to, sure. Right now, this is the ideal time to apply. So if you are a current high school senior or a current student who is enrolled in college and possibly looking to transfer, this is the time to apply. Your application fee is waived by visiting, or in this case, attending a virtual information session. And the application is available now. One of the more important dates to keep in mind is December 15th. So for current high school seniors, if you're looking to lock in your scholarship eligibility, you would need to apply by December 15th. You will notice that we are test optional for 2024, so you do not need to submit an SAT or ACT score to be admitted or to be reviewed for scholarships. So that's not something that you would need to do. Basically, all we would need is the transcript and an application. What we are going to need to be able kind of to determine if you are a good fit for this program, we're going to be able to glean from your high school transcript or your college transcripts. So the application process really is not very time or labor intensive. And again, just my recommendation is to make sure to apply prior to December 15th for scholarship eligibility.
Do you want me to go to the next slide? Because
yeah, if you don't mind, yes, thank you, Dr. Zaleski. And then so in the previous slide I had mentioned the scholarships. These were the scholarship programs that I was referring to. So you can see some of the different awards, and there's a pretty specific matrix on our admissions website, bloomu.edu/admissions, where you'd be able to see, all right, if I have this GPA, this is what it would equate to in a scholarship. So there is a good opportunity out there to see where you might land, and also maybe, hey, a couple percentage points below the next scholarship bracket, and that would increase what I might be eligible for. So, it's our goal to reward you for your academic success. I'm sure you're all very good students, so we want you to come to CU-Bloomsburg for sure. As you're looking at a program like speech language pathology, you already know you're looking at graduate school, right? So one of the things you want to be cognizant of, okay, is what are you paying for your bachelor's degree? And I should have mentioned this. These are last year's numbers. There was a slight increase for this year, and I do mean slight. But you want to be aware of what you're paying, right? And the one thing I am extremely confident in is you will get tremendous value in your education by coming to Bloomsburg. And you can see the in-state and the out-of-state costs there and how they would compare versus the other types of colleges that are out there. You'll get good value in education. Can guarantee that for sure. And for people who already know that they're looking at least a master's, possibly a doctorate degree, you want to be aware of that, because that's going to, a master's and a doctorate degree will cost more as well. Now, like doctors, oh, sorry, go ahead, Dr. Zaleski.
That's a good point. What Tom just said, simply because my wife and I talk about this all the time. My wife's a nurse, and she's actually a graduate from the Bloomsburg nursing program.
Oh,
Also, and so different people we know have talked to us about different things, and they'll say, oh, I want to go to, especially like the nursing, there's less programs in communication science and disorders, but oh, I want to go to Penn, for that. Great, not a problem. But what you have to keep in mind, kind of like Tom was saying, right? So depending on what your undergraduate cost is, you have to go to graduate school. And so you want to go to a quality program, undergraduates, that will prepare you for graduate school. And keeping in mind that's going to be more expensive, because what you have to keep in mind is, and my wife and I say about this all the time, yeah, you can come to Bloomsburg and okay, after 4 years of college, you may have $15,000, $20,000 worth of debts. Right? You go to University of Penn, you have $120,000 worth of debts, maybe $200,000 worth of debts. Well, when you start your first job, the starting salary is $40,000. They don't say, oh, you went to Bloomsburg. Oh, we're only going to pay you 30. You went to University of Penn, you have more debt. We're going to pay you 70. No, starting salary is this. And that's where people sometimes get confused or don't think about it from that perspective, because this is, as Tom says, you need a graduate degree. So you need to go into a good undergraduate program to get a quality foundation to grow, because it's really the graduate program that is going to train you. And what you have to keep in mind is, this is also where people get confused. You hear people say you never go to the same graduate school that you went to the undergraduate school. Well, what you got to remember, a lot of those programs, depending what it is, you're seeing the same faculty teaching the same content at the higher level. You're not getting that, you're just getting a sprinkling of what you need undergraduates. It's really all in your graduate program that you're really getting the content. So a lot of times I've had undergraduate students come to me, people have told me, you never want to go to graduate school. And I've heard the same thing. I went, again, I will speak for myself. I went here for my bachelor's, for my master's, and I was able to get into Columbia and NYU for a PhD. So
right. Well, and Dr. Zaleski too. So you said you went to Columbia and NYU. That's a perfect example. There were probably a lot of other people there that paid a lot more money for their undergrad degree, but were in the same exact class that you were in. I think that just goes to show you're going to get tremendous value, and you're not going to find a better program for this than what you would find at Bloomsburg, and you're going to save yourself a lot of money in the process.
Yeah, and I will be honest and tell you, when I first went up to Columbia and NYU, I was like, oh boy, here I am, small town Bloomsburg person coming in with the Ivy League schools, and I had a better core education than people who went through Columbia, went through Brown, went through Yale, went from Harvard, and I was surprised on the things that they didn't understand. And that's why I came back to Bloomsburg, because I had such a quality education, and when the opportunity came up, I wanted to give back and say, you know what, I want to prepare the next generation, so they have that same experience and have the quality to go wherever they want to go.
Yeah, absolutely. So again, it's absolutely tremendous value, and you'll see that demonstrated here. And Dr. Zaleski, could you go to the next slide, please?
Sure.
Right, and then that gets us to the questions. So it could be about the program itself. It could be about application and admission. And the one thing I would suggest to you, if you haven't come to campus, strongly recommend visiting, either for a daily campus visit, which we offer every day, or come for an open house, or possibly for a major showcase day. There certainly is a lot to offer here. Great question here from Kendall. Are there any prerequisites required in order to be considered for acceptance into the SLP undergraduate program, for instance, like observation or volunteer hours?
No, nope, not at all.
Yep. So, and that's a good question. That's a good question.
It is
Because there
good
are
question, but there
programs
are
in.
no, yep, there are no prerequisites into it. Obviously you want to have some good quality courses. Both audiology and speech pathology. More audiology is based in the sciences, but you need to know the sciences also for again, like I said, the anatomy of how you swallow and all of that helps. But if you had some good science courses in high school, you get some math courses, you'll be fine.
That's a great question. So, Dr. Zaleski, one of the questions that I have for you is, all right, so you listed a lot of coursework, and we also heard a little bit about your research interest. What are if you had to pick a class or two, what's your favorite class to teach and why?
Well, I mean, they're all. I mean, are you talking about graduate or undergraduates?
I would say either.
Okay, they're from the undergraduate perspective. I've taught the intro to audiology, auditory training, and the fundamentals. They all have a different one. Really, what makes it fun for me are the students in the class.
Yeah.
Because when you have a good group of students who are engaged and asking good questions, and the nice thing about it is when you have those good students and asking good questions, it actually challenges us to get to go further and deeper versus students just sitting there nodding. When we get to the graduates program, again, I kind of like them all. It depends on the course, but again, if I had to, I'd probably say the tinnitus and auditory processing class, because that's my areas of expertise. But I've been here so long and I've taught so many different courses. There's probably only a handful of the AUD courses that I haven't taught. So it really depends. From my perspective, it depends on the students in the class. That's who really make it interesting and fun for me.
So one of the questions I have, so this is, it's a health profession, preparing people to work with patients, right? Or just people who are looking for some type of medical help. What are the undergraduate classes like? I would imagine, given what the career outcomes are, there's probably going to be some mix of theory, some mix of application, probably smaller class sizes. Like, what does a normal class look like?
Yeah, and that's it. It depends on our cohort size that comes in, but usually our classes are probably between about 25 to 40 students in a class. And you're exactly right. It's a mix. It depends on the type of class. Obviously, like the anatomy and physiology of the auditory, speech, language, and hearing, that is more theory, and you're looking at examples, and you're looking at models. But again, you need to know that. But there are courses where, yes, like the phonetics course, where you learn how to listen and how to transcribe, and that's part of it. So when someone's talking, you phonetically learn how to transcribe the different words that people are saying to figure out what they're saying, or the issue. Same thing like Introduction to Audiology. There's a blend of theory. I'm someone, when I teach my classes, you can ask my students, I always start off with the theory. Because if you don't have the foundation theory, you can't grow on anything. You can't build upon it. So I teach that way, my undergraduate and my graduate courses. Obviously, undergraduate courses, yes, they can be challenging, but at the same time, they're reasonable. They're nowhere. They don't go as far as in depth as the graduate courses. It is, most of them are a blend, and it depends on the course. Like the Introduction to Communication Disorder, not a lot of theory. It's mostly, what do these professions do? A little anatomy and physiology, what type of therapies people do, and about the governing bodies. So it depends on the course.
Great, thank you. Another question here. If you go into college undecided or under another major, is it easy to change over to speech pathology?
Well, yes and no. It depends, one, on the size of our cohorts that we currently have, and two, it depends on your current GPA. Because again, you have to get into graduate school. If you to most graduate schools require a minimum of a 3.0 to be eligible to be reviewed. That doesn't mean you're getting in. All that does is it gets you a ticket into the door to be reviewed. Then it's a competition, and they take the best and the brightest. So if someone is another major and they have a mid two, a low 2.3, 2.1, well, it's going to be kind of hard to get their GP up high enough to get into a graduate school, but if you're in another major and you have a strong GPA, above a 3.0 and even higher, yeah, you have a greater probability of getting in because you have to get into graduate school, and so my philosophy is yes, we could let a student in with a 2.1, right? But the odds of that student getting to the 3.0 to get into graduate school, now they have this degree and there's not a whole lot of options for them. So why let them in? So there are many factors that determine whether or not students can or cannot get in.
So it sounds like it's possible, but a lot of that would be dependent upon the student's achievement in college since they've been eligible.
Yes. Yep. And also the achievement on the type of courses. Right. There's a difference between, a student has, a 2.931, and they're sophomores, they've already taken advanced courses in psychology or maybe special ed or sciences, or they're sophomores and all they've taken is 100 level courses, all introductory level, and they have a 2.9 or 2.8. So all those things come into play. Like I always tell students, it's not the number, it's how you get there that makes the difference. So big difference. And when I advise undergraduate students, a lot of students will say that to me. Oh, I'm concerned. I have a friend who had a 3.5 and couldn't get in. And I always say, time out. You can't compare just because someone had a 3.5. How did they get there? Do they have a lot of repeats, a lot of withdrawals, a lot of retakes, or did they have good quality courses, never repeating? So big difference. So it's not just the number, it's how you get to that number that counts.
So, final question before we log off here. Dr. Zaleski, do you have any kind of parting advice? Anything that you would recommend for a senior in high school or a current college student maybe looking to transfer? What kind of classes should they be taking? Any way that they could become more familiar with the field or the program? If you were to advise young Tom Zaleski his senior year of high school, which was a mere 10 years ago, I'm sure.
Yeah.
What would you have told, a younger Dr. Zaleski?
I would, again, it will depend on whether your interest is speech or audiology. If you're interested in speech, taking maybe a psychology course, taking grammar courses, maybe like a special education course, a audiology, a science course, a math course, psychology course will be good. Always, it's a good idea. If you're not sure, you don't know, do some observations if possible. It's getting harder because facilities are making it more difficult or are not accepting people for observation. But if you can, observe, to see what's going on. You may not be able to get into a medical center, but there might be a local private practice or a small clinic where you can call up and say, hey, can I come in for a day and observe. And what I always tell students that do that, remember, our field is small, both audiology and speech pathology. There are not a lot of, so people know a lot. And what you got to remember, so if you're going to go out and observe, put your best foot forward. Yes, it's summer out. That doesn't mean you wear flip flops and torn jeans or a mini skirt and, go, ask them what their dress code is. Is it business casual? Is it a shirt and tie? Every place is different. So you want to put your best foot forward. So because you never know, you might be wanting to go to that place for an off-campus rotation, or you may be interviewing there someday. You never know, and people remember, oh, I remember that person. They came to observe and they had sunglasses on, chewing away on gum, and flip-flops on, and on their phone all the time. Nah, we're not even going to look at this person. So first impressions last a long time.
Perfect. Well, great. Well, thank you, everybody. Thank you, Dr. Zaleski, for joining us tonight. Really appreciate your time, and thank you, everybody, for tuning in. And whether you watch this live or or you're watching the recording, please do not hesitate to reach out to Dr. Zaleski or myself. We are happy to help in any way that we can. We work for you, and we're happy to do so. So
Yep.
We look forward to hearing from everybody in the future, and hope you have a wonderful night.
Yeah, feel free to check out our website. Our communication science and disorders website. You can find my contact information there. If you have any questions, be more than happy to help anyone.
Absolutely.
Thank you all for coming.
Everybody, have a good night.